I'm Kelly Warner. When breast cancer is caught early, your chances of surviving the disease are extremely high, and researchers are learning more about this type of cancer every day. But breast cancer is not just one disease. It's different for each patient. That means treating it requires an individualized plan. Dr. Keith Wells, a medical oncologist with Willamette Valley Cancer Institute in Corvallis, says breast cancer is not the same for everyone.
Each individual's breast cancer is different, and it affects them in different ways. Where it has spread to, how big it is, all of that plays a role into different treatment options.
Targeted therapies can be used to treat breast cancer by targeting specific characteristics to cancer cells, such as a protein that allows the cells to grow quickly or abnormally.
When breast cancers are evaluated in the pathology lab, then certain stains are put on them to look for the estrogen receptor and the progesterone receptor, as well as a protein called HER2. And whether the breast cancers express those receptors and proteins depends on what treatment we can give them.
Researchers and oncologists now know that being able to target a certain aspect of a tumor leads to better outcomes for the patient.
Because a lot of times those mutations are what's driving the tumor. Its growth, its replication, its resistance to dying. And so if we're able to shut that mutation off, then we can shut off that cancer. And in general, we can say that not only is it more effective, longer lasting, but also many times less toxic. And that's an important part of our treatment.
However, medical oncologist Dr. Jon Gross says in cancers that have no positive hormone receptors, including a subtype called triple negative, targeted therapies don't work. So treatment is often a combination of surgery, radiation, and chemotherapy. Another area of breast cancer research right now is focused on immunotherapy.
Which these are harnessing our own immune system to recognize the cancer and attack those cells. So we have made some tremendous strides over the past few years, and there's still active research that I would anticipate that our survival rates continue to improve over the years, without a doubt.
It's estimated that 85% of women who develop breast cancer have no identifiable risk factors. That's why regular screening is so important. 3D imaging has had a significant impact on breast cancer screening by catching cancer in its earliest form. And early detection often means less treatment and better outcomes for patients. 3D mammography also reduces the number of women being called back for false positive test results. I'm Kelly Warner.